Hi, my name is Pegah Maleki, and today I'm excited on behalf of our team to share about this project with you all, examining the impact of community-based food insecurity programming on immigrant populations. Food insecurity is a significant public health issue widely affecting individuals and families across the globe and disproportionately impacting racial and ethnic minority populations. Food insecurity rates are specifically high among immigrant families who may have less social support and less access to and awareness of food support resources and programming, and lack of access to culturally acceptable, inclusive services, taking any language barriers into mind. Community-based programming may be able to provide culturally adapted models aiming to decrease certain barriers to access, like transportation to and from a site, by housing services in the community they aim to serve. Specifically, community-based food insecurity programming can be a solution to support immigrant participants in obtaining food security. The objectives of this systematic review were to comprehensively examine the existing literature to assess the impact of community-based food insecurity programming for immigrant populations based on 3 different outcome measures. First, looking at health outcomes, so examples being improved dietary diversity or reports of health and nutrition education. Second, food insecurity outcomes, examples being measures using validated screeners or qualitative methods to measure food access. And finally, social outcomes, so examples being social cohesion or feelings of togetherness. As a secondary question, we examined the facilitators and barriers reported for each program's success if the data was available. Our study selection process is outlined in Figure 1, the Prisma flow diagram. One reviewer screened the title and abstract and then full text of all articles retrieved from a literature search in 5 databases. And 2 reviewers critically appraised and assigned quality ratings through consensus meetings for the included articles. One reviewer extracted data on the outcomes, facilitators, barriers, study details, as well as intervention and participant characteristics modeled after constructs from the Consolidated Framework for Implementation Research. And finally, another 5 articles were excluded during extraction, overall resulting in 18 included articles in this review. A small snapshot of results can be seen in Figures 2 and 3, with 5 unique intervention types identified with multiple subtypes. The majority of interventions amongst the 18 articles were urban agricultural interventions, including community gardens and home gardening programs. Many facilitators and barriers were identified, with a few described under the results section on the right-hand side of our poster. One facilitator for participant involvement in interventions that stood out was participant pride in the investment that came from engaging in the intervention, specifically when permitted leadership or program implementation roles, like helping found the intervention or maintain it, was available. An example of this was through co-maintaining community gardens. A barrier that stood out were the impact of concerns related to personal immigration status affecting intervention engagement. This was seen through concerns of participants being deported or detained on their way to the intervention site, as well as mental health concerns related to worries over personal and family statuses that impacted and reduced the desire to eat overall. Within Figure 3, we described the number of articles that reported each type of outcome within each gear, with 2 examples of thematic findings per each outcome. For social outcomes, for example, 16 out of the 18 total articles reported social outcomes, many falling under the theme of an intervention improving social cohesion and a connection among participants by increasing socialization, and the theme of interventions enabling support towards participant resettlement and belonging to a new country. Overall, community-based food insecurity programming had a positive impact on immigrant participants, improving community wellness through increasing social capital and the avenues for food generation that can be self-powered, decreasing reliance on other coping strategies or charitable food assistance. Policymakers and other funders should fund interventions that aim to support culturally adapted models centering participant investment and enabling social networking to support long-term population-level food security for immigrant populations. We're happy to answer any questions, and thank you for checking out our poster.